Good afternoon, everyone. Myself, Sunita. Welcome back to another session of Cancer Care at Medical Oncology Institute, Mangalagiri. And today we have with us Dr Srujana Joga, Consultant of Medical Oncologist, AY, Mangalagiri. She has done her post-graduation DNP in General Medicine at Care Hospital, Hyderabad. Subsequently, she has done super specialty course in Medical Oncology at Rajiv Gandhi Cancer Institute and Research Center in Delhi. She is the author of many publications, national and international journals. She has a keen interest in research and was a co-investigator in various ovary, breast, colorectal and lung cancer clinical trials. Welcome, Doctor, behalf of AY Malveri.
Thank you, Sunita.
As a part of health, Doctor, today's topic is ovarian cancer. What is meant by ovarian cancer, Doctor?
It is an abnormal growth of cells in the ovary, which are the main female reproductive organs.
How common is this ovarian cancer, Doctor?
Overall, it is the fifth most common cancer in India, and specifically when we see the statistics in the Indian women, it is the third most common cancer after the breast and cervical cancers.
What would be the risk factors for this ovarian cancer, Doctor?
So, the patient-related factors like age. Any person who crosses 50 years of age, the females are at higher risk for developing ovarian cancer. There is, for every each year of addition, there is 11% risk for developing this cancer. And patients who are obese, whose body mass index is more than 30, they are highly likely to develop this cancer. And we have females who attain early menarche, that is before the 12 years the first menstrual cycle occurs, or females who are having late menopause when they reach the menopause at the age of 52 years or beyond. So these women are exposed to maximum duration of reproductive cycles, and there are a lot of hormonal disturbances, and they are at risk for getting the ovarian cancer. And females who have never been pregnant or who have never given breastfeeding are highly likely to develop this ovarian cancer. The other thing is genetic risk factors. Around 20% of ovarian cancers are hereditary. That is, they have the genetic mutations. The most common one is in the BRCA1 and 2. So they give a typical history of having breast or ovarian cancers in the family, in their first or second degree relatives. The other less common and controversial risk factors are the endometriosis, where there is an abnormal growth of the uterine tissue into the ovary. So the role is controversial about its ovarian cancer incidence in these cases. And the postmenopausal hormonal replacement therapy used for more than 5 years is also said to be associated and not to be associated with it. And the infertility treatment where the GnRH analogs and antibodies are being used for ovarian stimulation. So these patients might develop a low-grade ovarian cancers in future, but the risk is very minimal.
What are the stages of this ovarian cancer, Doctor?
So the ovarian cancer has 4 stages. The stage 1 being where the cancer is limited to the ovaries, and stage 2 where it spreads into the pelvis and pelvic organs, and stage 3 where it spreads into the abdomen also, and stage 4 where it is spreads to the other organs like lungs and liver.
Are there any types of ovarian cancer?
Yes, ovarian cancer doesn't mean that there is only single type of ovarian cancer. There are different 3 types. Just like a plant has different parts like root, stem, leaves. So the ovary also has some layers covering it. So the topmost layer which covers the entire ovary is called epithelium. The cancers arising from this layer are called the epithelial ovarian cancer. These cancers occur in females who are more than 50 years of age. On the other hand, we have germ cell tumors arising from the germ cells in the ovary, where these are most commonly seen in 20 to 30 years of age in the younger population. And the stromal cell tumors, which occur in between 30 to 40 years of age.
What would be the clinical manifestation of this ovarian cancer?
The ovarian cancer's peculiar nature is that it does not have any typical symptoms. Patient will be having very vague complaints like abdominal discomfort or fullness. because of which they will be having weight gain also. Because of the growth of the ovary inside the abdomen, it occupies space and there will be some fluid secreted into the abdomen also, due to which patient will have weight gain and they will have pelvic pain and discomfort. The other thing is that they have bowel and bladder disturbances. That is, they have constipation going on for 3 months or more, and urine retention problems and voiding difficulties will also be there.
How can we diagnose this ovarian cancer?
So ovarian cancer can be diagnosed from the basic investigations like the ultrasound abdomen, and for the beta staging we get a CT scan of the abdomen and chest, and whole body PET CT in some cases, and the blood test CA-125 tumor marker, which is specific for the CA ovary. It will be elevated in more than 90% of the cases.
What are the treatment modalities for this ovarian cancer, doctor?
So the treatment of ovary constitutes multimodality treatment: surgery, chemotherapy, targeted therapy, and in advanced stages, first chemotherapy is given and then patient will be taken for surgery. Again, the chemotherapy can be given through intravenous route, as well as during the surgery, the chemotherapy can be given into the directly into the abdomen, which is called HIPEC. And there is also the targeted therapy, which is also given via intravenous route.
How can we prevent this ovarian cancer, doctor?
So ovarian cancer can be prevented in patients who have BRCA mutation, or in persons who are known to have BRCA mutation. So if they have that, if we ligate the ovaries and the fallopian tubes or remove them, we can prevent ovarian cancer in this subset of patients. Apart from this, there are some protective factors which can protect us from the development of ovarian cancer, like use of the oral contraceptive pills and breastfeeding, have a parity, that is having 1 or 2 children, pregnancy, and use of having tubal ligation surgeries, hysterectomy, and salpingo-oophorectomy surgeries.
Are there any screening tests for early detection of this ovarian cancer, doctor?
So as of now, there are no screening tests for the detection of ovarian cancer. So the common misconception is that this HPV vaccine is used for the prevention of the cervical cancers, not the ovarian or the breast cancers. So we should be aware of all these vague symptoms. Any symptoms persisting for more than 3 months, the patient should approach the nearby physician and then get investigations done accordingly, so that we can detect the cancers in the early stage.
Are there any vaccines are available for this ovarian cancer, doctor?
No, there is no vaccine for the prevention of the ovarian cancer.
Thank you, doctor. Thank you for your very valuable information regarding ovarian cancer. Thank you, ma'am. Thank you all for watching this live session. Please stay tuned with us and subscribe to our channel. If you have any questions, please comment in the chat box. Thank you.